You're listening to Where Before Meets After. What do you do for an elongated lip? Is there a procedure for that?
For elongated lips, a lip lift is usually the answer. It involves a small incision on the base of the nose, and it shortens the distance between the nose and the lip line, the Cupid's bow, and that often everts the lip and gives a nice extra lip show, which is often lost as we age as well. People have thinner looking lips because of that skin elongating. And then when that is brought up, the lip you see better. And then again, its relationship to the nose and the rest of the face often looks better as well.
Do you do standalone lip lifts? Is that something that you do?
I do standalone lip lifts. They're really a great procedure. The scar is typically well hidden and people can see the lip better. It looks fuller. And then if they do decide to add volume, all of a sudden they can see their lip rather than it just kind of disappearing, particularly when they smile.
How would you know if you were a good candidate for a lip lift?
You're probably a good candidate for a lip lift if your upper lip is thinner than your lower, if your distance between the base of your nose and your Cupid's bow is longer than average. It's tough to know for yourself. It's something that when people have conversations about their lips, sometimes that's where that discussion comes in if they haven't already researched that procedure. I do think that people are seeing and talking about that procedure more often because in general, I'm seeing more of those people coming in to discuss them. And sometimes people are candidates for it. And sometimes people that come in and request it, they aren't because they just don't have enough distance between the nose and the lip. And then the lip would look too close to the nose, which then even if they can see more of the pink lip, they will not really see much at all when they smile because it'll all disappear under the nose.
What's the recovery like for a standalone lip lift?
Usually the stitches are out after a week and they are presentable. You could have some bruising. It's definitely going to still be pink, but it doesn't take very long before you can put a little makeup over that line once the sutures are out and be on about your business. It's tender, but it's really a pretty rapid recovery.
We have this in the bucket of underrated but powerful procedures because they make people look so good and it's so simple, right?
Yeah, it is. It's one of those it really makes a change with a relatively small investment of time and recovery.
Thanks for listening. I'm your host, Eva Shea. Follow the show and submit questions for our experts at wherebeforemeetsafter.com. Where Before Meets After is a production of The Axis.